Hello everyone, in this video we are going to discuss about laryngomalacia. So what is laryngomalacia? Congenital softening or floppiness of the supraglottic tissues, that is epiglottis, arytenoids and the aryepiglottic folds. So what is glottis and what is supraglottis? Glottis is nothing but the vocal cords along with the space between them is called as glottis. Here it is marked in the picture with the yellow circle. We can see it is glottis. And next, what is supraglottis, which is above the glottis? The main function of the glottis is voice production, that is the phonation, because they will vibrate, the vocal cords will vibrate whenever the air passes through and produce the sound, airway protection and also breathing control. So what does this supraglottis does is, it is main function is the airway protection. It will prevent the food from entering the lungs and airway and the lungs whenever we eat. So the main function of the supraglottis is airway protection. The main function of the glottis is phonation, airway protection along with the breathing control. So what happens in laryngomalacia is there is incomplete development or immaturity of the laryngeal cartilage along with the poor neuromuscular control. So the poor neuromuscular control, because there is immature innervation of the laryngeal muscles causing poor tone and dynamic collapse. So there will be floppy supraglottic tissues. So we know there is negative intrathoracic pressure during inspiration. This negative intrathoracic pressure will pull the soft supraglottic tissues inward. So this will cause partial airway obstruction causing inspiratory stridor. So we will hear high-pitched sound whenever the child will inspire. So in this picture we can see this is the normal epiglottis along with vocal cords and the arytenoids and aryepiglottic fold. What happens in laryngomalacia is there is omega shaped epiglottis along with short aryepiglottic folds and prominent arytenoid mucosa. So we can see normally the airflow is normal in the whenever the structures are normal. Whenever there is laryngomalacia, we can see there is epiglottis which is folding over the airway, which is blocking the airflow. So there, and also there is soft larynx. This is the laryngomalacia. So what happens in normal airway is the cartilage is very firm and strong. In laryngomalacia it is soft, floppy and also immature. The supraglottic structures will stay open during inspiration, so the airflow is normal. But in laryngomalacia, it will collapse inward, causing inspiration. In normal airway, even though there is negative pressure, there will be no collapse because because of the cartilage which is strong and firm. But here there is soft and floppy immature cartilage causing collapse, and there is airway obstruction during inspiration causing stridor. So by definition, it is softening or congenital softening or floppiness of the supraglottic tissues. So the onset is from the birth to few weeks after birth. There will be inspiratory stridor, as we can see in the picture also. There is obstruction to the airflow during inspiration, so causing inspiratory stridor, which worsens with feeding, crying and the supine position. So because these will cause more amount of negative pressure, causing more amount of inspiratory stridor. So there are also feeding difficulties, choking and failure to thrive because the protective mechanism of the supraglottis is lost. So there is this. The pathophysiology is immature laryngeal cartilage with poor neuromuscular tone causing supraglottic collapse during the inspiration. So the diagnosis is through flexible laryngoscopy. We can see the collapse of the supraglottic tissues structures during the inspiration. Mostly the management is conservative. The majority of the cartilage there will be strengthened within 18 to 24 months, but even whenever there is severe in cases of severity, the child may need supraglottoplasty. The prognosis majority will outgrow by 18 to 24 months. It is most commonly associated with gastroesophageal reflux disease, that is GERD. So this is the laryngomalacia.